Thanks for tuning in. I'm Shannon from Diary of a PA Mom. If you watched my last video on contracts, if you haven't, you should watch it. This is my mom, Karen. So again, she just recently retired. She's been a nurse for 45 years. She started in ICU, then was charge nurse, house supervisor. She was manager of outpatient surgery, director of surgical services, and then for the last 10 years, she was chief nursing executive. So she's done lots and lots of interviews. So today, that's what I wanted to talk about. I wanted to talk about interviews for physician assistants as well as nurse practitioners, and maybe throw some nurses in there as well. So the first thing I think is important is the area that you're gonna work in. So why is this important? If you're married, if you wanna have kids, you need to have a layer of support. So if you're able to be a stay-at-home parent, then that's not as big of a deal, but if both people are gonna be working, you need a layer of support. You need to find out what that looks like for you. Do you have grandparents? Are you gonna have a babysitter? Is there a child care in your area that will take sick kids? You need to find that out ahead of time. The second is your specialty. So originally I was gonna work in cardiothoracic surgery, but then I decided orthopedics was where I wanted to work, so knowing your specialty. All the things, you have the area, you know the specialty you wanna work, now you're gonna apply. You've gotten the interview, now you wanna dress the part. So similar to going into a contract negotiation, now you wanna dress the part. So for men, that's gonna be suit and tie. Make sure you're freshly shaven, obviously that you're clean. If you wear earrings, take those out just for the interview. For ladies, again, business suits, dress. I'm a shoe gal, I like to wear heels, but ladies, you might be doing a tour and you wanna make sure that you can keep up on that tour. So don't wear sky-high heels, professional makeup, professional jewelry. Anything to add to that?
Nope, that's professional. People will be looking, especially if you are applying for a professional position, whether it's in a clinic, whether it's in a hospital. That is one of the first impressions speak volumes. So good point.
So now that you have the interview, you might receive an itinerary. So on that itinerary, you might have the names of the people who are going to interview you. So I would kind of start to stalk them. So get on Facebook, get on Instagram, get on the internet, start looking, look at what their background is. If they're a physician, where did they go to school? What are their hobbies? What are they interested in? I think it's really important to know your interviewers, so that way you might have something to chat about, which will make your interview stick in their mind. The other thing is, know the organization that you're going to work for. What are their core values? What are important to them? Do they have a big expansion coming up? What is going on with that organization that you can really help them with? Agreed?
Yep, agree. The one thing that they're going to be looking at, especially if you are applying in a competitive market where they may have 10, 15, 20 other people, that's exactly what they're going to be. What is going to set you apart from the other candidates that they're going to be interviewing? And one of the things that, and I could probably get into this later, is be prepared. Be prepared for your interview. Google, the internet is a wonderful source of most frequently asked questions in professional interviews. Don't overlook those, because the organization that you go into, some have just one-on-one interviews. You may just have a one-on-one interview with the chief nurse executive or the chief medical officer. You may do panel interviews. You may have interviews where everybody has standardized questions and scoring sheets. So the better prepared you can be, so you're not doing or act like you're unprepared, will set you apart.
So the next I think is know your job description. What are they looking for, and what skills do you have that can make that facility better with what you are applying for? As far as the interviewing goes, you want to be confident. You want to walk in with open body language. Sit up straight. Don't cross your arms. That looks funny. Pleasant smile on your face. Don't get aggressive during the interview, obviously, but just make sure that your body language is appropriate, you're open, and you're friendly. I think that's have you had any bad interviews where people were scowling?
Oh yeah, I've had hundreds of bad interviews. Yes, yes, I have. And the first thing is, I probably, when I interview people, I have always been probably an aberration, because instead of standardized questions, I prefer to have a one-on-one and get to know the person. I can learn more about a person's work ethic, their behavior, their clinical expertise by spending 20 minutes with them in a relaxed setting than I ever could with standardized questions. However, as everything has changed a little bit, and that you have to have a system whereby you show no bias, where everything is standardized, where you can say this candidate scored the best, that isn't always how people, prefer the one-on-one interview. So be prepared for whatever they throw at you.
And I think, and you can Google the most common questions, but I think the question, they're going to ask you to open up is, tell me a little bit about yourself, which I hated because I never know, what are they looking for? Do they, really want to know about me and my background, college, what I did, or what exactly are they looking for? So what were you looking for when you asked that question?
I think you want to see how well-rounded they are. If they were raised in a small town in South Dakota and went to school at a small college in South Dakota, and you're applying, for example, at the University of Seattle, or if you're applying for Mayo Clinic, where they get a variety of patients from different cultures, from different backgrounds, they want to be able to see how well-rounded you are, how well you're going to fit. Are you going to be a good fit into that organization or not? Did you come from a huge city and maybe you went to USC, and all of a sudden you are applying for a job in a rural facility, maybe a critical access hospital to get some loan repayment, where your average daily census is 2 or 3 and they have 1 surgeon, and the patients that you're going to be interviewing are mostly going to be agriculture or small town people. How well are you going to fit? How well are you going to adapt to that? So tell them a little bit about yourself, what you like to do, where your background a little bit, what were your hobbies, did you volunteer in school, what is your passion? And they want to know that you're a real person, that you're not just someone stiff who is coming to them with a 4-point GPA. Personally, I didn't like to hire. This is a personal bias. I preferred not to hire 4-point GPAs, because what that told me was that you might have taken chemistry or differential equations 4 times to get it. Can you communicate with patients? Do you work well with others? If you get a challenging patient, do you have the skills to be able to talk them through? Maybe it's a cancer diagnosis, maybe it's an upcoming surgery, and they don't understand a word of what you're saying. That's what I would prefer not to hire 4-point students, but
yeah. So, and especially be able to know. So if you need to, write it out ahead of time, so when they ask you that question, you're prepared and you don't have to fumble through it. The other 2 questions I hate are, what are your strengths and what are your weaknesses? So strengths are pretty easy. The other thing is weaknesses. So usually people give, the answer like, oh, well, I tend to be too punctual, or, I'm just too hard of a worker, and they're going to roll your eyes. They want an honest answer. I think whatever your actual weakness is, they want to know how you've been able now to turn it into a strength. And that will tell them a lot about who you are, that you were able to really work through something that was hard for you.
The other question that sort of throws people is, you think you've gotten to the end of the standardized questions and you think that you have done everything you can, and then somebody says to you, tell me why we should hire you for this position. We have 12 other candidates. Why should we hire you? Because it's hard for people to pat themselves on the back or say, here's why I think I'm the best candidate. But truly what we're looking for is, we're not looking for, do we want somebody with clinical expertise? Absolutely. But you're looking for somebody that's a good fit for the organization, that is a hard worker, that is flexible, maybe with some policy adjustments, that is going to be able to dialogue with patients, with your physician, with a multitude of other physicians. If you're going to be a surgical PA, you better have pretty thick skin, and you better understand OR people. They are very different. They are very different than if you just are a surgeon. People that work in the OR, much like surgeons. And so you have to, are you going to be okay with that? Or are you going to go home crying every day because somebody said something mean to you? But be prepared for that question. Why should we hire you? And be prepared to talk about your strengths. Be prepared to talk about that you love the area of the country. You've always wanted to work here. You came from X number of your family did whatever it was. And so you have a love for this. You have a love for the service that you're going into. Whatever it is, you have to convince them. And this is kind of a sales job in a way. What is going to set you apart if they have 20 other candidates? Because you have to leave them with a pearl, if you will, because when they look at all the papers, the standardized questions that they have, where they have scored you 1 to 5 or A to F, whatever it is, What is that one thing that they're going to say, you know, what I really liked about him or her was, and take it from there.
Yeah, that's great. They're also starting to do a lot of behavioral questions. It's kind of a new thing that's coming up. So they're going to ask you, how do you handle a difficult physician? Give me, for instance, when you handled a difficult patient and what did you do? They really want to know how you're going to handle things, and that will tell them about your personality. The other thing is be positive. So if they ask you, oh, give me a time when you handled a difficult physician, don't start bashing that physician, especially if you're going to be working with them. You have to spin it in a very positive light. Everything has to be positive. So again, make sure that before that interview, you've written those things down so you'll be prepared and you can keep it positive. Sure, you keep it positive.
And the other questions that they are starting to ask now tend to have an ethical slant to them, especially if you are a mid-level, a nurse practitioner, or a physician's assistant. And they like scenario questions, and they might, you have a coworker or you have a colleague that you believe is taking drugs from the clinic, from the OR, whatever. How would you handle that? And you need to be prepared, first of all, from what are your ethical responsibilities for a nurse practitioner in the state that you're applying, or for a physician's assistant. The second thing is where, you have to be able, without throwing them under the bus, to be able to say that you would follow the law, first of all. You would follow the rules and regulations that you have as a nurse practitioner with the Board of Nursing, or for a physician's assistants, the Board of Medical Examiners, because you answer to your physician. But be prepared for some ethical questions. It may be patient-related, it may be colleague-relation, it may be your physician, that you have witnessed some impaired behavior. For example, in the OR, he's come to the OR with alcohol on his breath, and that you think that his skill isn't the same. What would you do about that? Be prepared to address that in a professional way, without throwing him under the bus, without being negative about it. Just be informed, be educated.
Be informed. Yep, be positive. The next thing is, if you have a weakness on your resume, you need to be able to address that. So if you're a new grad, your weakness is that you don't have any experience. So you need to be able to roll that into a positive light. The other is if you've just job hopped. If you've been there less than a year, if you've done that several times, you need to be able to really sell why you love that area, love that hospital, love the people there. They need to know that they're not making a bad decision hiring you. They're going to ask you about their hobbies. That goes back to tell me a little bit about yourself. So know what your hobbies are. Do you like to bike? Do you like to read? Do you like to do things in the area? So when we live in Montana, they're not going to like to hear that you like to go shopping in a big city, because here you're not going to get it. What they want to know is, do you like to bike? Do you like to do outdoorsy stuff? Are you going to stay here and take care of those patients? So the other thing is, before the interview, set yourself up for success. Write these things down. So what are your areas of success? When have you handled a difficult situation? How did you handle it? What were the positive aspects? The other thing is, what skills did you bring to that? Teamwork, communication skills, integrity. All of that needs to be written in there, and you need to know it kind of cold, so you're not stumbling through the interview like, You already know, you've already been in that situation, you know it, so write it down. That way it's ingrained in your mind. You can put a positive spin on it and be articulate about it.
Agree.
The best thing that helped me with interviews was getting in front of people beforehand. So especially when I was a new PA going in for interviews, sitting down with people who had done lots of interviews or were in that business to ask these questions, even the ones I didn't know very well. So several friends I had, their parents, I went in and interviewed them. I didn't know them very well, so it's kind of that awkward situation that you have with interviewers. They asked me some weird questions. It just helped me prepare. The other thing is, since we have access to technology, film yourself. Do you have any weird tics? So for myself, when I get really nervous, my lip starts to shake. I ended up having to take propanol. I didn't know that till I actually saw it. So do you have weird things? Do you, tongue flick? Do you tap? What do you do so you can stop it in just that cool, calm, not like you're, ready to crawl over the chair in your interview.
The other thing I would, when you meet people, make eye contact and shake their hands. Shake their hand. Don't. It is a real off-putting to most people that are interviewing to either get a limp fish handshake with 2 fingers, or to get someone that's really sweaty. And everybody understands. Everybody that's interviewing. When as a CNO, I know that it's intimidating. It's intimidating to come. We are prepared, and some people, unfortunately, take great delight in putting people not at ease, if you will, at trying to make them feel uncomfortable. I personally don't think you gain anything from that, because if you're looking for a long-term fit for the organization, you want to try and make them comfortable if you can, but you want to still figure out what are their strengths, their weaknesses, what are they going to bring to the organization, how are they going to handle a situation. To squirrel back just a bit on the ethical piece, they may ask you an ethical question about yourself. What if you made a med error and nobody knew it? If you're in the OR and you're closing and you leave a piece of suture, you leave a little needle, you notice this, what are you going to do about that? And it's back to, what are you going to do when nobody's watching? But Shannon made a really good point. Know the organization's core values and their expectations, so that you can see, first of all, if those even mirror what you're looking for. They may not. So preparation.
And the last thing is ask questions. So at the end, when you prepared, you've had this interview, you think you've done really well, and they're like, oh, you have any questions? And you say no, that doesn't look good. So ask questions, have good questions. So you can ask what the core values are. You should already know that because you've done your homework, but ask what the core values are. How big is the hospital? What's your patient load? What's your expectation going to be? Do they need you to take call? How often do you take call? Are you always going to have access to a provider on site, or are you going to have access by phone? What does that look like for you? And are you working nights, holidays, weekends? What is the shift you're working? And I feel like you can ask them, what the best part is that they like about working for the organization, or what they like working in that area. How do they feel about it? I think that's good to ask too, because it's good for you to know. Because all of a sudden at the end, if they don't know why they like it, I think that's a red flag.
I think that's a really good point to wrap up an interview, to say, as I've walked around, as I've had a tour, as I've interviewed, it seems obvious that everyone is very friendly and really likes the organization. How long have you worked here? What do you think the number one reason that you stay is? That's all right. And they're going to say, oh, they're doing their homework. They're looking for a long-term fit, just like we are. So that's a really good point too.
Yeah. So ultimately, I think the best thing is to be prepared. Also, with some of the interviews that I did, so you had your main interview with administration and then the physicians, and then the other PAs took us out for dinner that night to get used to the group. So if you actually go out with nurse practitioners or the physician assistants that are going to be working in your group, really get to know them. What are their activities? Do you mesh together? Still be on your best behavior. You don't want to slam anybody. You need to be positive and professional, because they're looking, are you going to be a team player? Are you a good communicator? Are you going to be one that's going to throw someone under the bus? Are you going to be the one that tries to push call onto someone else? They need to know that they're bringing in a strong person who's going to take good care of their patients, but also take good care of each other. And when you start working with people, you end up being a family. So they want to know that you're going to be part of the group and that you're going to be a solid family working together. So know that. So be positive. Make sure you like those people, because you're going to be working with them for a while, hopefully, and you want them to have your back too.
The only other thing I would tell you is, if you go out to dinner, don't get too comfortable, because it is still an interview and they're still watching you. So if you are on your fourth martini, and you are kind of knocking the silverware over, or you are saying, well, bud, and you've gotten too comfortable, huge red flag and a big red X. So you're kind of interviewing them and vice versa. Don't get too comfortable in a dinner.
Yeah.
Just remain professional.
Yeah. So know yourself, sell yourself. You got skills that they want. Let them know that. All right. If you like this, give me a like. Otherwise, we'll see you